Hi, everybody. My name is Shira Reiner, and I'm a cord blood bank nurse, and we are on our journey to talk about stem cells. So, welcome, talking about stem cells, and today we have a very fun guest. Hi.
Hello, my name is Dr. Alex Melhuish. I'm the clinical director of Vitalia24, and I'm very happy to be here with you today.
We're happy to have you. So, we are going to discuss about what you do in your clinic, and we're going to start discussing who are the patients walking in your door.
We primarily treat neurological and neuroinflammatory disorders at our facility. The age range, depending on the disease or the condition itself, can vary, but we primarily have two age groups. We have the 3 to 11-year-old pediatric patients, and then we have our older patients, and those are normally for neurodegenerative diseases themselves. So it's kind of split between two groups of patients that we normally treat, but they're all under the umbrella of neuroinflammatory and neurodegenerative diseases.
I think our viewers are not really sure what that means. Can you specify what kind of conditions can be included in this group of patients?
For example, when we talk about neuroinflammation, we normally think about neurodivergent patients, such as patients with autistic spectrum disorder patients. Those are normally our younger cohort. Our older patients, those with neurodegenerative diseases, those are normally ALS or other neuromuscular wasting diseases that we can help treat.
Okay, that's very interesting. Let's talk about what happens to this person standing on the other side of the ocean sometimes that is interested to come for stem cell therapy. So, what do they need to have or know so they can apply to you?
Well, first of all, we have the medical team where the medical information, the general condition, so the information is sent on to the medical team. Our medical team evaluates the primary information, and then if it looks like we could help, then we arrange a medical teleconsultation where we get more in-depth information. Sometimes we get more scans, or we can get actual reports from their own attending physicians. And then based on the medical interview, the provided medical information, the extra medical information that sometimes we need, we have a medical meeting every Monday and Friday where, depending on which patients we're going to be evaluating, we'll have a neurologist and a pediatrician there. And if we think that the treatment can be beneficial, then the next step would be to have another teleconsultation with the patient or the patient's family in some cases, then arrange a treatment protocol. Depending on the patient's ability to travel, which is in some cases pretty limited, we expect to see them within 2 to 4 weeks in our hospital in Turkey.
Okay, so just so I understand, when we want to come for treatment, for example, we go through a process of consultation. The first part will be sending some documents, filling up some paperwork, and then we have an online consultation with the doctor where the doctor interviews the patient to understand exactly what's the situation. And then you guys sit down for a concilium of doctors saying whether this patient will benefit from treatment or not.
Yes.
And then if the staff thinks that it's a good patient for the clinic, then you have a second consultation discussing the specific program for that specific patient.
Exactly.
It's
Exactly.
very much a tailored program per person.
Yes. Also tailored per the disease itself and the person.
Okay.
Exactly. Exactly.
And then the next step will be getting an appointment, showing up. What does it look like for a patient?
Like I said, we have two teams at Vitalia. We have the medical side and we have the logistic team. In cases like this, once treatment has been confirmed, then our logistics team takes over and helps arrange hotel and airport pickup. In some cases, depending on the patient's family's own needs. For example, our autistic patients, they have specific dietary requirements, specific dietary needs, and so the family always request a kitchen or kitchenette type accommodation. Things like this, our logistics team arranges. We have a small hotel as part of the hospital that we work with. And so most of our patients and patients' family members prefer to stay in a location like that. But if they don't, then our logistics team will help them with their accommodation and their transport arrangements.
So they will come in and out of the clinic depending of their treatment. And while they're in clinic, they have stem cell therapy, and then they go back to the hotel. When the treatment is finished, they go back home, right?
Yes, once the total treatment protocol has been completed, there's a follow-up medical interview, an exit interview, if you like, where extra information is provided. And also the treatment continues because we also incorporate intranasal exosomes into our treatment package. So once they've taken the IV, intravenous exosomes and mesenchymal stem cells on each day of treatment, their treatment continues when they go home because they'll be continuing with intranasal exosomes.
Okay, so our patient has now gone home, and I'm reminding everybody this is a patient with neurological and inflammatory processes going on. What happens to this patient at home? What do they need to know? What do they need to do to benefit from this treatment the most?
For example, for our ASD or neurodivergent patients, part of the criteria for inclusion in the treatment is that they have a stable and regular therapy at home. It could be speech therapy, it could be organizational therapy, cognitive therapy. We find that just providing or treating patients with stem cells and exosomes is good, but without the follow up physical and educational therapy, for example, the true effects are not seen. The massive dramatic effects are, in fact, quite limited. So, one thing that we do insist on, for example, for our ASD patients, is that they have a quite a comprehensive speech and language therapy as part of their continual treatment. We have some ALS patients in Europe, for example. These patients, they have weekly or 3 times weekly physical therapy. And what we do is we work with the physical therapist and the rehabilitation doctor to monitor and assess the muscle improvements that we see after treatment or with treatment. Things like this. For example, we have specific types of physical therapy treatments or exercises that over the past decade, we've seen, based on cumulative evidence, that, for example, specific neck exercise, specific jaw exercises are very, very important for ALS patients post stem cell treatments because it really starts to help them with regaining some form of communication, reducing the saliva that can build up. These are small, very small quality of life hacks, so to speak. But with the past 10 years experience, we've seen that these post-treatment follow-ups that we have, for example, on the seventh day, on the 14th day, and on the third week post-treatment, they're very important both for us to follow the improvements of our patients, but also for our patients themselves to continue having that support post-treatment.
So what we're saying is that motivating our patients post-care has a great significance on the result. So it's not enough just to come in for stem cell therapy. It's important for clinics to do post-care or post motivation, maybe is the right word for this, to allow patients to keep on track, keep on working, doing the correct exercises, working enough at home. And I think maybe this is the most important message. Stem cell therapy on its own is great, but it's only part of the equation. The
Yeah,
work that
it's
you
not a
do at
magic bullet.
home, it's not a
It's
magic bullet.
It's incredible. I mean, it's as close as you can get to magic without being magic, but it's not a cure-all. And this is something which, unfortunately, in our industry, we see a lot of advertisements for one treatment cures all, which is not the case.
I think it's really important to discuss this because very often I hear from patients that are coming to a lot of clinics. I work with a lot of clinics and I've seen lots of protocols. But I think it's so very important that as clinicians, we put emphasis on this post-care process. We have people getting guarantees that this process will work for them, and we have people that are not being educated enough on post-care and what it looks like and how important it is to come into clinic already with post-care processes in mind because it's very often something that people forget to do. And so I have children or adults coming into different clinics and forgetting that once they come home, they have a limited time where these cells are active. And so it's not something that's forever. They cannot start a rehabilitation process 6 months after treatment. They have to start it right away. Also, keeping them motivated. You're absolutely right. We have patients coming into clinics, starting a process, being very good for a week or two, and then after a month time, they get tired and they forget that these cells, they take time, and the result takes time. And so that brings me to my next question. How long should you work at home? For how long should we keep this very labor intensive rehabilitation program at home? What's the most important time to do it? How long? How intensive?
Well, in the case for neurodivergent patients, we normally provide a list or an activities list quite in detail on how to not only motivate yourself as a parent, but also to keep that interest and motivation of the child themselves. For example, if they're more interested in physical activities or more interested in looking at graphics or book pictures, for example, we tailor the follow-up therapy accordingly. We have 3 or 4 patients. We have 4 patients at the moment just in the UK, where we have meetings every 10 days. They only last about 30, 40 minutes. And we go through that last session's improvements, for example, better eye contact or more attention versus more concentration, for example, in within the class or at home. For our older patients that have, for example, the neurodegenerative diseases, unfortunately, we work in tandem with their own physical therapist, with their own neurologist doctor, to try to keep up their motivation and try to understand that yes, some things aren't cures, but at the very least we can increase
Mhm.
quality of life, decrease muscle loss, get back movement from the head and the neck, bring back the voice in certain patients, which we've seen. These things step by step, they're drop by drop, so to speak, but they fill the bucket up. Once the patient's family see the improvements, their motivation increases or even returns in some patients, unfortunately. And as you know, people who are motivated, they tend to do better work. So, as we all know, not just as you, but as we all know, people motivation and being happy has a great effect, especially in these neurogenetic patients. So when they start seeing the improvements, we start to build on this. But of course, every patient is different. Every prognosis is different. We've had some pretty sad conversations in the past couple of months, for example, with patients themselves that know that their condition is terminal, but having the stem cell therapy or in this case the exosome therapy at home for them gave back 3 4 months of quality of life that they would not have had with their family and their loved ones. So it's not only treatment, not only managing expectations, but there is definitely a psycho counseling side to the post treatment follow ups.
I tend to agree. And it's so very important to remember, especially with the older patients that are coming to gain quality of life, not necessarily quantity of life, that it can buy you more time with your loved ones, more time with abilities, better time. And it's something that's very rarely being discussed because we are all looking for a cure. And unfortunately, it's very rare the case that we can offer a cure, but we can sometimes offer quality of life, which is not least important. Thank you so much, Doctor, for being with us today, and we will continue seeing you in our next episode. And for
Thank you.
anyone, for anyone willing or interested to speak to Dr. Alex and his staff members, you can click the link below and contact them. Thank you so much, Doctor, right here below. Thank you so much, and we will see you in our next episode. Bye.
Thank you. Bye bye.